It's time to talk about the elephant in the waiting room: atrial fibrillation. Afib is a real burden for everyone involved. We know it increases stroke risk, but Afib also increases heart failure risk. If left untreated, the patient has a 46% greater risk of death. Yet Afib is not taken seriously enough. Surgeons treat it during heart surgeries less than 30% of the time, and referring physicians may not even think about Afib as a factor in determining the best treatment plan. For the patient, Afib decreases general and mental health. Their medications are numerous, complicated, and create constant worries about bleeding, stroke, or falling. Many are contraindicated, require complex dietary restrictions, and come with nasty side effects. For a person with Afib, life stinks. The outlook for Afib patients is not altogether grim. Data show that surgical ablation during heart surgery reduces mortality, risk of stroke, and other post-surgical complications, both at 30 days and long-term. Perioperative mortality may be reduced as much as 8% and stroke as much as 16%. Concomitant surgical ablation to treat Afib isn't as risky as you might think. Patients have improved quality of life. It helps them live longer. It may even improve their heart failure status. SDS and HRS guidelines have a Class 1 recommendation to treat Afib in heart surgery. Surgical ablation gives patients the best chance to return to sinus rhythm and reduce the burden of Afib. While Cox-Maze 4 yields the highest efficacy, even a pulmonary vein isolation may yield up to 60% efficacy, which is higher than any other single intervention for persistent and long-standing persistent Afib. Each additional lesion set adds more efficacy, up to 90% with the full maze. While performing surgical ablation, the surgeon also has the right tools and the highest chance of excluding the left atrial appendage. So, if concomitant surgical ablation works, why aren't more surgeons doing it? Even though data show that clinical outcomes and mortality improve with concomitant surgical ablation, especially in CABG patients with Afib, it is still notably undertreated in the US. Less than 10% of patients with Afib get surgical ablation, the treatment with the highest efficacy to restore sinus rhythm. When it comes to CABG patients who are the most likely to also have heart failure, less than 10% get surgical ablation for their Afib. Take Gary, for example. In the 12 months since he was diagnosed with Afib, Gary's had 2 trips to the ER, 10 outpatient hospital visits, and over 50 interactions with physicians, his general practitioner, an electrophysiologist, and others he can't even remember. Each time, he has to arrange for transportation. That's time and money. It's exhausting. Medications cover most of his kitchen table, and he's had more blood draws than he could count. He could have written a novel in the time he spent in waiting rooms. Today, the doc of the week is the interventional cardiologist for a diagnostic cath, whatever that is, and they're talking about stents versus a CABG, cutting him open. After the procedure, the frenzy continues, with a referral to a surgeon, another appointment, another waiting room, then new instructions, medications, procedures, and so on. Gary wonders if he'll ever be able to think about anything other than his heart conditions. Gary doesn't know it, but his life could get a whole lot better if his surgeon, Dr. Dino, would treat Gary's Afib with surgical ablation at the same time he does the bypass surgery. It doesn't add much more time once you become proficient. Since he has to tear down the wall, literally open his chest to fix the quote-unquote plumbing, why not fix the electrical Afib issue at the same time? Restoration of sinus rhythm helps patients live better and longer. Sinus rhythm matters. Over 14 articles and more than 48,000 patients have shown in 1 year, 2 year, up to 15-year follow-up that the patient lives longer. There's another bonus to surgical ablation. If a patient has surgical ablation and also has heart failure, which CABG patients are more likely to have, the ablation can help improve their heart failure. Not only have you treated the patient's Afib, you may have also given them a chance to increase their ejection fraction and improve their New York Heart Association class. You have the once-in-a-lifetime opportunity to make a big impact on several comorbidities at the same time. Be a part of the heart failure solution. Start treating. Treat more often. Use surgical ablation to treat heart surgery patients with Afib.